Welcome to the Vocational Expert Views channel. We're a new channel where we will be discussing disability issues from a vocational expert's point of view. Most of our videos will be focused towards veterans and veterans disability, but we also cover Social Security disability as well as long-term disability, personal injury, workers' comp, and other topics. Today, we're going to be looking at the DBQ for mental health. You need to know what the DBQ is and what they're looking for so you know what it's about and how to improve your claim. You need to review the DBQ form before seeing the doctor, and this is true whether it's a VA doctor or a private doctor. And since we're focusing on mental health today, this would go for the psychiatrist or clinical psychologist. You want to review this DBQ because you want to be prepared and know what questions they will be asking, why are they asking them. So again, today we're focused on the mental health DBQ. So what you want to do is go to your search page. You're going to type in VA DBQ. And then right here, you go here and then you double click here. And it's going to open this page up to you here. And this page has every DBQ there. So you can scroll down and you can see each of these are DBQs that you can pull and review. And we go all the way down here to psychological. And as you can see, there's a DBQ for PTSD as well as a DBQ for eating disorders. So those are separated out, but we're going to go to mental disorders. So you would click that link here and it brings you to this page here. The page that your provider is going to fill out. All right, so they're going to put your name here and your social security number here. Now, you need to make sure that if you do this outside the VA system, that the person you're getting this from is qualified to fill out this form. Right here, it'll tell you, in order to conduct this initial examination for mental disorders, the examiner must meet one of the following. Ensure that the person who fills out this form meets these qualifications, otherwise a VA won't take it. Are you a VA health provider? If you're doing a private person, more than likely this is going to be no. And is the veteran regularly seen as a patient in your clinic? Now, it says, was the veteran examined in person? Now, for mental health, it can be no. You can do telehealth. However, it has more, the thing would have more weight if the person does see you in person, especially for the mental health issues. But that's not mandatory. But it does helpful. Down here to the diagnosis, and then if they assess you with, and then if they assess and agree with issues, then they're going to put it in. For example, they would put in major depression, and then the ICD code is something you don't have to worry about, but that stands for International Classification of Diseases, and your provider will know that, and they'll put that in. For example, F32. And then if there's any comments or extra issues they need to put into that, then you would have like anxiety could be put in there or another disorder. If there's other issues, then they would put it down here. And then medical diagnoses relevant to the understanding or management of the mental health disorder. So a lot of times, your physical health affects your mental health, for example, TBI and things like that. And so that's where this information will be put in. Okay, so this is section 1 again, and this is going to be where your diagnoses are. Now we're going to move down to differentiation of symptoms. So what this is, for example, a lot of times they're not able to differentiate between, let's say, TBI or stroke or insomnia. They're not able to differentiate between one condition and another. It would take more clinical evidence and testing. And the DBQ is kind of like a one-shot one-stop shop visit. So that's where they would put this in. And of course, this goes back to the medical diagnosis is relevant to understanding the management of mental health condition. And you'll see a lot of times where if you ever question why the doctor didn't differentiate between depression and bipolar, again, generally you have to do a clinical psychology test, like a personality test, like the Minnesota Multiphasic Personality or the PAI or something like that. And a DBQ really is just to get the diagnosis and to get basically a VA rating. It's not really for treatment or differentiation of the diagnosis. And that's kind of like how these are treated oftentimes. So that's why a lot of these things just will be lumped in under the same rating. And, depression, bipolar, insomnia, again, they'll just put it in here. So if you want those differentiated, your clinical psychologist will need to do more testing and things. So as I said, usually once they have enough for a diagnosis, they just put it in and don't necessarily differentiate. All right, so now part 3 is extremely important here. And this follows directly to the 38 CFR. So let's go to that. So what we do is you go into your search engine, you type in VA CFR 38, and come down to here, and then here's your CFR. So we scroll down here, and of course, this is CFR for everything. And again, this is for mental disorders. So this is for the diagnosis, and you can download this. And this is for your diagnosis here. One, two, three. Okay. And then right here is for the evaluation of the mental disorder. And you can download it here. So you go to your search engine and you just type in VA CFR 38 mental health ratings chart, and then come right here, and then it opens it up. And this is the Code of Regulations. So this has everything in it. And as you can see, here are the general rating formulas. So for 100% rating is total occupational social impairment due to such symptoms as gross impairment in thought processes, communication, persistent delusions or hallucinations, grossly inappropriate behavior, persistent danger of hurting self and others, intermittent ability to perform activities of daily living, including maintenance of minimal personal hygiene, disorientation to time, place, memory, or loss for name. So basically what they're looking for here is someone who's been committed. So if you're in Florida, that's the Baker Act. Have you been Baker Acted consistently several times a year, or at least one time a year for 3 or 4 years straight? In California, it's also known as 5150. Persistent danger of hurting self and others. This is suicide attempts, Um, Intermittent ability to perform activities of daily living. This is where you go without showering or bathing or brushing your teeth, several days at a time, not one or two, several days at a time. A lot of people think they're at 100%, but really, if you think about 100%, for me as a professional counselor, when I think 100% at this, I'm thinking about someone who is either institutionalized or needs to be institutionalized or possibly needs to be in a halfway house. And so that's why it's extremely hard to get this. Now, I understand there are some clinical psychologists and counselors out there that will give this real easy. But again, if you look at this, total occupational social impairment, loss of names or close relatives, this is someone who can't balance their checkbook or, buy things at a simple store. Again, this is someone who basically needs to be institutionalized or in a halfway house. A lot of people would fit better in the 70 or the 50% range. Okay, so let's go back to the DBQ. And as we stated, this section here, occupational social impairment, relates directly to the 38 CFR rating. All right, and then for the indicated occupational and social impairment, is it possible to differentiate which impairments are caused by each mental disorder? That goes down to here. Again, we see the TBI, and a lot of TBI symptoms mimic mental health issues, and it's hard to differentiate between that. So that's why it's there again. This is also why you see a lot of veterans say that their TBI is rated under mental health and not separated out. So then we get to clinical findings, and this is really important. No records were reviewed. Records were reviewed. If your provider checks this, no records were reviewed, then unless they do a lot of testing and spend a lot of time with you, this DBQ is not going to carry a lot of weight. They need to make sure they put down records reviewed and put information in this box. Next, we get down to history. So, relevant social, marital, family history, occupational and education history, mental health history, legal and behavioral history, relevant to substance abuse, and other. Here we come down to the symptoms section, and these are the most popular symptoms. There are basically thousands of mental health symptoms, and so they can put the notes down here, but these are the primary ones that are usually seen. So, behavioral observations. This is where the clinical psychologist is going to say individual is friendly, rapport was easily established or not established, the person couldn't stay on task, the individual was tangential in their speech, which means they went from one topic to another topic and couldn't complete a thought or a statement. Based on your hygiene, how you walked, how you did things. Then we have other symptoms here. And then next we have competency. Now, this is where we go back to, as a professional counselor, competency. So this is where the individual is homeless or unable to manage funds. So if a person is unable to manage funds, they're more likely to be 100%, in my opinion, or in a halfway house or institutionalized, and that's where this would be written down. Are you able to manage your own funds? Are you homeless? What kind of stability do you have? And then, of course, you have the remarks section. And this also includes testing. So did the clinical psychologist just do testing, like mental health screening, like you might see the Beck's form in there? High-powered clinical tests include the MMPI, which is the Minnesota Multiphasic Personality Inventory, or the PAI, or the DAPS. And these help differentiate between mental health as well as measure symptom severity. Current diagnosis, you want to really see continuous and chronic, which basically means not likely to improve or hard to manage. In service event with clinical records from service to injury. In your nexus statement, at least likely as not, more likely than not, or due to. And of course, if it's less than this and it's a private provider, you probably don't want to turn this in. Then the last section here is where the examiner will put in their information and fill this out. And again, if this is a private provider, make sure you get their CV to put in with this. So this is a winning strategy for disabled veterans. Now remember, when you're talking to your clinical provider or doctor, you want to separate it pre-military from military and post-military experience as far as concerns of symptoms onset and potential service connected. If you think it's pre-military, then you wouldn't be seeking this DBQ. Remember, you're looking for service connected. So when you come in for this, you're saying that my mental health symptoms are directly related to my military service. So you want to make sure you're very careful with what you talk about pre-military if you believe that your symptoms are due to your military service. By reviewing the DBQ, it'll help you be clear and concise when describing your symptoms and their impact. If you do a private provider, make sure you have a qualified provider who understands nexus statements and can write a strong one for you. Make sure you get a CV if it's a private provider to put in file with your DBQ. Thank you for watching. If you're interested in a TDIU vocational expert evaluation, we're here to help. Step one would be to schedule a personal consultation with us about your TDIU application, and you can do that by emailing us. If that goes well after the consultation, step two will be an in-depth look at your medical records to see what you're needing. Step three is we can do some psychological testing, so we will address if you need more testing. And step four, if everything goes well, then you'll be qualified for a vocational expert TDIU report. Be sure to like and subscribe the video and support our channel. Thank you.